So Medicare Part B is going to see the largest premium increase in history. Good morning, insurance agents of the senior market. Welcome back to Near and Far. It is Wednesday, November 17th. So we've got big news to share with you today about Medicare Part B and what's going on with premiums. But just keep in mind, if you want instant access to content like this when it breaks, make sure to subscribe to our YouTube channel and enable those notifications with the little bell down here to get access to that so it'll hit your account as soon as we post. Also, any questions about today's episode or anything you see today, you can email us at nf_studios@neischloss.com. So Medicare Part B is going to see the largest premium increase in history. That's right, ever. Premiums for 2022 are going to increase to $170.10, up from $148.58 in 2021. Now, these are obviously the standard premium amounts for Part B because you have individuals potentially with higher incomes that could pay more than that. But again, standard premium going to $170.10 for 2022. So CMS gave a number of reasons as to why for this incredibly large increase for next year. So first was rising healthcare costs, that costs are increasing. COVID-19 has increased expenditures at the Medicare level. So that was the first and foremost. Second, there was actually supposed to be a really big increase for 2021, but Congress actually interceded, fought CMS, and got them to only increase the premium by $3 last year for 2021. So there should have been a much larger increase for 2021 than what we saw. So I think what we're seeing is them trying to catch up and make up this increase to get back on pace to where they think they need to be. Lastly, and this is something that's super interesting, CMS is actively talking about setting aside reserves in the event that Medicare decides to cover Aduhelm, which is a new Alzheimer's drug. There's been a lot of news about it. And for agents to understand, if Medicare decides that this is going to be a covered drug, that it will cost $56,000 a year for individuals to take it, which would dramatically increase costs all across the government in terms of Medicare Part B, Medicare D, all of that. So again, trying to set aside some reserve dollars. All of that being said, this is really not going to impact your clients maybe as much as you think. Because on one hand, we have this increase in the Medicare Part B premium. On the other side, Medicare recipients are also going to see a huge increase in their Social Security payments. So every year, there is a cost of living adjustment that happens with Social Security payments. And for 2022, this increase is set almost at 6%. I think it's like 5.9 something. But again, almost 6%. That averages out to $71.40 per month per recipient on average. I mean, that's a lot of coin. So, and this increase is set to start in January of 2022. So in terms of net impact, dollars in, dollars out, most consumers are going to see an increase in their Social Security payments minus the Part B premium. It'll be a net win for them. It's a plus. So that's something important to keep in mind. Additionally, one other point of note that's kind of breaking news, the Part B deductible is going to increase by $30 from $203 to $233 annually. Now, where your consumers are going to see that is obviously a multitude of places. If they're only on original Medicare, they'll see it there directly. But we're probably also going to see it ultimately affect rate increases on Medicare Supplement plans that could cover that Part B deductible, like Plan F. So obviously, if the Part B deductible goes up $30, Plan F is covering that Part B deductible, there's probably going to be some rate increase action that we're going to see on Plan F business to make up that difference. So hope you enjoyed this content. Again, please reach out to us if you'd like any further information on this or any subject we discuss here on the YouTube channel. We will be back with you on Friday, November 19th, bright and early at 7 a.m. I'm Bill. This has been Near and Far. See you on Friday.